How do you communicate with dementia patients who confabulate? Imagine trying to have a conversation with someone whose mind creates stories that feel real to them. That's what confabulation in dementia is like. It happens when the brain fills in gaps in memory with false but believed to be true stories. These are not lies but unintentional fabrications, often caused by the brain trying to make sense of missing information. There are two types: provoked confabulation, which occurs when asked questions, and spontaneous confabulation, which happens without prompting. Understanding this helps caregivers respond with patience and compassion. When talking to someone who confabulates, avoid challenging or correcting their stories. Trying to prove them wrong can cause frustration, agitation, or withdrawal. Instead, focus on how they feel. For example, if they talk about visiting a loved one who has passed away, acknowledge their feelings without insisting the story is false. You might say, "It sounds like you miss your friend," which shows empathy without confrontation. Another key is to enter their reality. Validate their feelings and support their narrative gently. This can help reduce anxiety and make them feel heard. If they believe they are somewhere familiar or with someone who is no longer present, acknowledge their experience without arguing. Redirect their attention to familiar or positive topics. If they keep fixating on a false memory, gently shift the conversation to something comforting or enjoyable, like a favorite hobby or a pleasant memory. This helps break the cycle of fixation and keeps the interaction positive. Use clear, simple language. Speak slowly with short sentences and easy words. Avoid complex questions or instructions that might confuse them further. Give them plenty of time to process and respond without rushing. Nonverbal cues are also powerful. Use gentle gestures, maintain a contact, and keep a calm, friendly tone. Your body language can reinforce your kindness and understanding. Keeping a consistent routine and a familiar environment can help reduce confusion and the frequency of confabulation episodes. Personal items, photos, and familiar music can serve as anchors to reality and provide comfort. Patience is essential. Practice active listening by giving your full attention and avoiding interruptions. Speak to them respectfully, avoiding elder-speak, which can feel patronizing. Support their participation at their own pace, and remember that their stories are meaningful to them, even if they are not factually accurate. Using visual aids like photographs or objects from their past can stimulate genuine memories and create a shared connection. Reminiscence therapy, which involves discussing past experiences, can also be helpful, especially when guided by a trained professional. Always seek guidance from healthcare professionals for personalized strategies. Support groups for caregivers can also offer practical advice and emotional support. The main goal is to communicate with kindness and respect, focusing on emotional connection rather than factual accuracy. This approach helps preserve dignity, reduce distress, and foster a sense of safety for people living with dementia who confabulate. Remember, each person is unique, and working with professionals ensures the best care tailored to their needs.